cervical epidural steroid injection. This injection relieves pain in the neck, shoulders, and arms caused by a pinched nerve or nerves in the cervical spine. Conditions such as herniated discs, spinal stenosis, or radiculopathy can compress nerves, causing inflammation and pain. The medication injected helps decrease the swelling of nerves. The procedure is performed with the patient lying down. Intravenous sedation may be administered, and a region of skin and tissue of the neck is numbed with a local anesthetic delivered through a small needle. Using X-ray guidance, also called fluoroscopy, the physician guides a larger needle to the painful area of the neck. The needle is inserted into the epidural space, which is the region through which spinal nerves travel. A combination of an anesthetic and cortisone steroid solution is injected into the epidural space. The steroid is an anti-inflammatory medication. It is absorbed by the inflamed nerves to decrease swelling and relieve pressure. The needle is removed and a small bandage is applied. The patient goes to a recovery room, is given food and drink, and is discharged with post-treatment instructions. Some patients may need only one injection, but it may take 2 or 3 injections administered 2 weeks apart to provide significant pain relief.
Intrathecal pump implant. This is a device put inside your body to relieve long-lasting pain. It sends medicine into an area around your spinal cord. We call this the intrathecal space. The medicine blocks pain signals. It can work even when other treatments don't. Before your pump is implanted, we need to see if a pump can control your pain. We do this with a trial implant. During the trial procedure, we numb your skin. Then we insert a catheter into the intrathecal space. The catheter is connected to a temporary pump. You'll use this system for several days. If it relieves your pain, we can implant the permanent pump. For this surgery, you're given medicine to put you to sleep. We remove the trial catheter. Then, through a small incision in your skin, we place the permanent catheter. One end is placed in the intrathecal space. The other end goes under your skin, around your body to your abdomen. Now we're ready to place the pump. We make an incision in your abdomen and create a space under your skin to hold the pump. We attach the pump to the catheter. Then we place the pump inside you and close the incision. The pump is programmed with a wireless controller. When the surgery is finished, you're watched in a recovery room. Then you can go home. Follow your doctor's plan for a safe recovery. You'll come back for regular visits so we can check the device and refill the medicine in your pump.
Superior interspinous spacer. This is an implant that lifts and separates your vertebrae. It's used to treat lumbar spinal stenosis. That's a narrowing of the space around your spinal nerves in your lower back. The superior implant makes more room for these nerves, relieving painful compression. To begin, you lie face down. You are given medicine to help you feel relaxed. Your lower back is numbed. The surgeon may create a small incision in your back and work directly through that opening. Or the surgeon works through a tube called a cannula. With the help of a fluoroscope, an X-ray device that shows video images, the surgeon carefully inserts the superior implant. It is placed between the spinous processes of your vertebrae. Those are the bony protrusions at the rear of your spine. The implant expands, pushing apart your vertebrae and locking securely into position in your spine. This relieves pressure on your nerves. When the procedure is done, the incision is closed and your skin is covered with a small bandage. You will be monitored for a brief time and then you can go home. Your healthcare provider will give you tips to help your recovery. Spinal cord stimulator implant. Spinal cord stimulation, also called SCS, uses electrical impulses. Spinal cord stimulator implant. Spinal cord stimulation, also called SCS, uses electrical impulses to relieve chronic pain of the back, arms, and legs. It is believed that electrical pulses prevent pain signals from being received by the brain. SCS candidates include people who suffer from neuropathic pain and for whom conservative treatments have failed. The injection site is anesthetized. One or more insulated wire leads are inserted through an epidural needle or through a small incision into the space surrounding the spinal cord, called the epidural space. Electrodes at the end of the lead produce electrical pulses that stimulate the nerves, blocking pain signals. The patient gives feedback to help the physician determine where to place the stimulators to best block the patient's pain. The leads are connected to an external trial stimulator, which will be used for approximately 1 week to determine if SCS will help the patient. If the patient and physician determine that the amount of pain relief is acceptable, the system may be permanently implanted. At the end of the trial implantation, the leads are removed. The permanent implantation may be performed while the patient is under sedation or general anesthesia. First, one or more permanent leads are inserted through an epidural needle or a small incision into the predetermined location in the epidural space. Next, a small incision is created and the implantable pulse generator, IPG, battery is positioned beneath the skin. It is most often implanted in the buttocks or the abdomen. The leads are then connected to the IPG battery. The implant's electrical pulses are programmed with an external wireless programmer. The patient can use the programmer to turn the system on or off, adjust the stimulation power level, and switch between different programs. After surgery, patients may experience mild discomfort and swelling at the incision sites for several days. Physical therapy. If you have problems moving your body, physical therapy can help. It can control your pain and help you recover from injury or disease. It can help you get better after surgery. It can also help keep you healthy as you get older. Physical therapists are trained healthcare professionals. They must have a master's or doctorate degree in physical therapy. They are licensed by the state where they work. They are trained in physics, anatomy, human movement, and pain management. A physical therapist can make a care plan just for you. Physical therapy can reduce pain. It can help manage the pain of overuse injuries and some types of arthritis. You may be treated with heat, ice, ultrasound, or stretching exercises. Gentle exercises like walking and swimming can be used too. We call these low-impact activities. Physical therapy is helpful after some surgeries too. It makes you stronger and more flexible. Your therapist will show you exercises and stretches to help you get better. Physical therapy may improve some health problems without surgery or medicine. It helps control pain that goes on for a long time. We call that chronic pain. Low-impact activities are good for this. Water walking, swimming, and flexibility exercises relieve pain and stiffness in your joints. A physical therapy plan helps keep a chronic condition from getting worse. This can help you avoid surgery.
Living with chronic pain. If you have pain that lasts for more than 6 months, you have chronic pain. It's different from the temporary pain you feel when you hurt yourself. With chronic pain, you may not know why you are hurting. Your pain may affect your whole body and your mind, causing problems that ripple through every part of your life. But there is hope. Here are some tips to help you manage chronic pain. First, follow all your doctor's recommendations. Medications, physical therapy, and even surgery can help. So listen to your doctor's advice. Follow through with your appointments. Take medications as directed, and speak up if your care plan isn't working. Stay as active and as healthy as possible. Eat a healthy diet, get plenty of sleep, and exercise a safe amount every day. When you're active, your body releases endorphins. These are natural chemicals that help you feel good. Often, taking care of your body is not enough. Physical and emotional pain are strongly linked, so take care of your mind too. One of the best things you can do is reduce your stress. Minimize things that cause stress in your life. Hand some things off to other people. Learn to say no. If you still feel stress, try breathing exercises, meditation, or other relaxation techniques. Take care of your emotional well-being. Reach out to others, especially to friends and loved ones who understand your situation. Maybe you can find a hobby that lets you see your friends regularly. If you feel lost, lonely, or overwhelmed, find a local support group or talk to a professional therapist. Stay engaged and think positively. This will help distract you from your pain. If you take an active role in your care and follow your doctor's advice, you can learn to manage chronic pain and take back your life.
My last 3 discs are all messed up and had severe pain. I didn't know anything about radiofrequency ablation and did a lot of research on the internet about alternatives to surgery. I didn't really want surgery. I wanted a doctor to talk to me and give me some options. So in my research I've done, I found some videos and stuff on Dr. Gordon, which were all positive. So I made an appointment with him to see him, see if I was a candidate, if he could do anything for me. And I'm very active physically. I've done every kind of sport you can imagine in my life, and I take it to extremes, so I've been hard on my body and I'm paying for it now. With Dr. Gordon, when I met Dr. Gordon, he gave me alternatives. He told me, he said that, yeah, I can help you. I race go-karts for a hobby. So I've done every kind of sport you can, from martial arts to, I was a ski instructor. I've done everything you can think of. And I still race go-karts at 72 years old. And if I'm on my feet for 8 to 10 hours, which I am at the track, don't sit down, then I hurt at the end of the day. But it's about, probably compared to before the surgery, probably 80% relief compared to what it used to be. So it works. And people that are in chronic pain, doctors, your normal doctors don't tell you about this. People out there, if they see this, there is options. Pursue them. Dr. Gordon, he'll spend as much time as you need with him. He answered all my questions. He spent as much time as I needed to get those answers. The procedures and stuff he did is, the procedure I had was such a simple operation to be relief of the pain. It was a 15, 20 minute maybe operation. It wasn't even, I don't even call it an operation. You're in and out, they're done before you even realize they're done. By what happened to me, she wanted to talk to the doctor. So we made an appointment with Dr. Gordon to talk to her. She has steel rods in her back, and those steel rods, she was not a candidate for the procedure I had. But there's options, and he gave us an option of putting what they call a stimulator in her back. And she just finished that and got the stitches and stuff out Monday. And she's been in chronic pain for probably over 20 years now. And she says she's 100% pain-free right now. And that is amazing. So there are options out there. Even if you had steel rods put in your back, infusions, there are options out there that people need to know about. Really, I mean, her procedure was about probably a 45-minute to an hour procedure. Quite a bit longer than what mine was, where they had more involved in it. But it works, and people don't have to go around in pain. There's options out there. Dr. Gordon's, I wouldn't go anywhere else. I wouldn't talk to anybody else. He's wonderful. Give him a chance. Give him a chance. You won't be unsatisfied. You'll be happy. People that's never had back pain, they don't understand what you're going through, because you look fine and you get no sympathy because you don't look like you're in pain. But back pain is not fun. It's extremely painful. You can't, I hate to say this, you can't even sometimes bend over and tie your shoes because it hurts so bad. For that relief to come, it's just, I mean, it was constant. Getting in and out of the car, bending over, tying your shoes, putting your shoes on, putting your clothes on, racing go-karts like I do. It was extremely painful. At the end of the day, I'd get down, I'd sit in the car and drive an hour home to my house from the track, and I'd get out of the car and I looked like a 100-year-old man who couldn't walk. I mean, I hurt really, really bad. Now, something too, since my operation, when I get done racing, I sit in the car, come home, I have a little bit of discomfort and pain, but it's not nothing like it was. The next day, I'm fine. It recovers that fast. And in normal activities that you do, I have no pain. It's everyday life is normal. I mean, I don't have pain at all during the daytime, during normal activities. But my operation, I don't even call it an operation. My procedure was 15 minutes. You know, I was in and out, bang. You know, if you're on Medicare or even if you have insurance, whatever, this stuff works. And there's absolutely no reason for anybody to go walking around with pain, because there are options.